Okay, good morning, everybody. Thank you so much for joining me for our introduction to the Impact Capacity Assessment Tool, or the iCAT. My name is Lisa Mae Simpson. I get to serve as the Vice President for Learning and Engagement at Forefront. Hopefully you're familiar with who Forefront is and our mission, which is to build a vibrant social impact sector for all the people of Illinois. And we do that by providing education and advocacy, by doing research, and by mobilizing our members around campaigns that advance the sector. The iCAT is one of the benefits that we offer our members, and we feel like it supports education and capacity building throughout the sector, and we're glad that you're interested in learning more. Just a quick couple of housekeeping notes. Our phone lines are muted just to keep background noise to a minimum, but I do definitely welcome your questions. So if you would take a moment to identify where the chat box is, if you look down at the bottom of your screen or over on the right-hand side, you'll probably see it. Please do type any questions in there throughout the presentation, and I will definitely address them by the end. And lastly, we are recording this webinar and we will share a link with you afterwards, and that will live on our website. So if you'd like to review it or share it with your colleagues at any time, you are welcome to do so. All right, let's dig in. So our agenda for today is to talk about what the iCAT is, what it measures, when it might be right for you as an organization, and then how to get started, how to dig in. So let's go ahead and dig into that agenda. First of all, what is this iCAT? You may have read a little bit about it on our website. Essentially, the iCAT is an online organizational capacity assessment tool. It is a tool that acknowledges that effective organizations are made up of empowered people. So the underlying capacity building frameworks that are built into it are based on behavioral change models. And you'll hear me talk about that a little bit during our time together today. The iCAT is really designed to identify the capacity change levers that help organizations move from good to great. So it is an automated and online tool. It is based on the research and experience of Algorithm, which is the developer team that has over 15 years for each of their members as nonprofit evaluators, researchers, capacity builders, their experience developing the core capacity assessment tool, or the CCAT, if you're familiar with that, and iterating that based on ongoing user feedback and continued research on organizational effectiveness. So that's a little bit about what the iCAT is, but you're probably more interested in what it does and what it measures. So let's talk a little bit about that. The iCAT is designed to measure 6 core capacities and 28 subcapacities. Those core capacities you see on the screen, they're managing, leading, learning, overseeing, generating, and planning. And we'll get a little more into what those mean in just a second, but I do want to highlight the fact, again, coming back to this idea that the iCAT is based in behavioral science, that it looks at, and you'll see this in the question design when we get to some of the sample questions, this idea of empowered people. And by empowered people, we really think about people who have all of the capacity levers they need in order to do all of these things effectively, right? So do they have the energy? Do they have the knowledge? Do they have the opportunity and skills to lead, manage, learn, plan, generate, and oversee effectively? Again, and do those people who essentially, they make up the organization. So if you have empowered people, you have an organization that has all of the things that it needs to be effective and sustainable. That is the working assumption, one of the working assumptions behind the iCAT and what it is designed to measure. So let's talk a little bit about what we mean when we talk about these capacity, these core capacities. You'll see both the core capacities, those 6, and then the 28 subcapacities outlined here. And so when we talk about leading, what we're really talking about there is the capacity of an organization's leaders to engage and inspire stakeholders, engaging internal and external stakeholders to work toward a common vision and a mission. So that includes mission leadership, that includes doing that in the community. And you'll notice that there are a couple of these subcapacities that have that asterisk that says they are not applicable to small organizations or have annual budgets of under $150,000 or fewer than 2 full-time employees. This is really just meant to be an acknowledgement that we all are working appropriate to our own scale, and that some of these are not necessarily helpful to measure at that scale of, not that it's not happening, but that it is not necessarily useful to assess at that scale. So when you see those asterisks, that's what that's referring to, that those smaller organizations would not see this as part of their assessment questionnaire or report. When we talk about planning, that is really about the capacity of an organization. Obviously, yes, to plan, but also to make decisions, to use the guideposts that they have set up in their plan as information to inform decisions as they execute that plan. When we talk about learning, there's obviously a lot there, but what that really is core to is the ability of an organization to gather and to use information, to use data about the community that it serves, about its programs and strategies, and about its cost effectiveness when it comes to operations. When we talk about managing, that is really about how an organization uses and retains its human and other resources. Is it using and retaining those resources in an efficient and cost-effective manner? Generating is about bringing in those resources. So this is often where we focus a lot of our time and energy, but you'll notice that it really is just one of these 6. But it is about the ability of an organization to raise funds and other resources, the things that it needs to operate, including partnering with others to support the organization. And then overseeing is about an organization's ability, specifically at the board and the senior management level, to ensure their nonprofit's financial health, mission progress, and community impact. That's a little bit more about what we mean by these capacities and subcapacities, what the iCAT is measuring. And then what you'll see in the report, which we'll dig into in just a second here, is a few different areas. So the iCAT generates an overall capacity score as well as individual capacity and subcapacity scores. It includes an estimation of an organizational capacity stage, or it's sort of a snapshot of a developmental stage, and provides up to 10 capacity building recommendations. And those are based both on the stage and the stakeholder reflections, the survey taker reflections. And we'll take a look at some samples of those. Those recommendations are often what I encourage folks to spend the most time on. The scores and the stage are helpful context for conversation, and then those recommendations are really where you can start to think about what appropriate action might be. And then there is a summary of the capacity building history that is part of the report that can be an ongoing interactive tool, and we'll take another look at that again as we get into this over here. So let's go ahead and look at that. What you will see once you have gone in and once you've taken the survey and are looking at your report. So the score, as you'll see, there's an overall capacity score. There are scores for each of the core capacity areas, and then each of those core capacity areas do break down into specific scores for subcapacity areas. So in this example, we're looking at an organization with an overall score of 82, looking like they're pretty healthy. Resource generating, I will tell you right now, is generally the lowest score, folks, and these scores are, again, really they're snapshots of the survey respondents' experience of the organization. And you may relate to this feeling of always never feeling like we have quite enough money as an organization. Generally speaking, that is one of the things that informs that low score for most organizations around resource generating. And then that capacity score then breaks down into some more specific subcapacities when it comes to bringing in money. So we look at board fundraising as well as fundraising from grant makers, individual donors, marketing, partnering with others, and the capacity of staff to fundraise effectively. So I want to talk a little bit about this organizational capacity stage piece. So this is what informs these components, or what informs what we'll see in the next slide in terms of organizational capacity stage. So the tool really looks at 3 different things. And again, it gathers this information through the survey responses, as well as the additional questions that provide some more background on your organization, and we'll talk about how they gather that in a little bit later. But this idea of organizational capacity stage is informed again by these 3 components. So program is the organization's ability to effectively deliver its programs or services. And as you all know, a strong program is really the foundation of any effective nonprofit. We are as good as the service or the program that we deliver, right? So that is clearly central to this model. Growth is a representation of an organization's ability to scale itself. And that is thinking in terms of a business that can expand its programming. I do want to be clear that none of this is meant to measure on a scale of bigger is better, right? So this, as you saw, this assessment scales for smaller organizations and is appropriate for smaller organizations. So you're not going to get a lower score because you're operating at a smaller scale. This is really about, does the business model support what you're doing, and can it scale at an appropriate level? And similarly, the collective, this idea of the collective, that represents an organization's ability to expand its impact into the community. And again, bigger is not necessarily better. This isn't about, are you ready to scale nationwide? This may be looking at, depending on your organization's need, it may be looking at, are you in a place where you could serve 3 families instead of 1? So that collective is really thinking about community impact, not necessarily scaling up to get bigger. So what you'll see on your report, based on all of those components, is an estimation of your organization's capacity stage. And you'll notice that this is a little bit of a cycle here, right? So most of us start with program modeling. Again, acknowledging that program is one of the most important factors of nonprofit health and success. What we do is what makes us matter. And then we tend to, so once we've really gotten our program down, we tend to move into either managing the business model piece of it through moving into business development, moving into more of a growth phase. We sometimes circle back to program modeling. We sometimes move into mission advancement. We move in between these stages. So it's not really unidirectional. And again, this is meant to be a snapshot and to provide context. So this is not a grade. None of this is meant to be a grade, but really just contextual information that can inform your conversation about where you might want to go next. And speaking of where you want to go next, I think one of the most, as I said, helpful pieces of the iCAT report, I think, is these capacity building recommendations. And so you'll see each report includes up to 10, not always 10, but a maximum of 10 prioritized recommendations for capacity building actions that you might consider taking. And again, they're recommendations. No, there is no mandate here. it does provide a decent amount, I think, of context and suggestions. So in this sample, we're seeing a suggestion that for this particular organization, that accountability around implementation might be an area to focus on. And so you'll see the headline there says that, you know, the iCAT results for this organization signal that its leaders identify some challenges with the board's capacity to oversee strategy implementation. And I'll just point out that this is specific in that it names the folks within the organization that are where the challenge might lie and where we might want to focus our efforts. So this is specific to the board in this case. And that's really helpful information because it helps us target our intervention or our response more effectively. So you'll also see there's a little more context here in each report around what's meant by that challenge, and then it often breaks down into up to 3 sort of more refined or specific kind of sub points. So in this case, again, we get some specific information that might inform our interventions or our choices about how we want to build our capacity in this area. You see that challenge A is around leaders and managers perceive that the board and the executive team lack the information. And so there's that really key phrase there. They lack the information they need to effectively assess and address whether the organization is successfully implementing its strategic plans on time. So there's a recommendation paired with that around allocating board time for pulling together and reporting on progress, right? Now, what that looks like, you know, those are choices that that you get to make, but the recommendation is at least specific enough, I think, to help you design an intervention that is likely to be more effective. The challenge, so challenge B, there's again a kind of sub-bulleting on this overall recommendation. The board does not have much practical experience overseeing strategic plan implementation. So again, this is different, you know, related to this overall challenge of the board's capacity to oversee strategy, but we have both a lack of information and we have a lack of practical experience. So those require different responses and different recommendations. And then finally, challenge C, that there's a perception that board and executive team members are not prioritizing and allocating the time necessary to effectively oversee. So we have information, we have experience, and we have time. And so those are all things, they may be solved by some similar interventions, but there are very specific ways that we can start to intervene and change specific levers that we can pull to start to change some of that behavior. The last section of the report that you'll see is this capacity building plan. And that does break down into the core capacity areas as well as the subcapacity areas. It mentions, you know, when something is recommended, gives a little summary of what is recommended. And you can also use this as a living document if you choose. Again, no mandate, but it's an available tool. Your report stays open to you as long as you'd like to use it. And so if it's useful to you to use this as a living document to track what's been recommended, what you've maybe submitted a grant proposal for, have made another type of request for, and then what you've implemented. And then, should you choose to, again, as a forefront member, you can take the iCAT up to once every 12 months as a member benefit. And so eventually, if you choose to continue to take the iCAT on an annual basis, you will be able to get this longitudinal view of what your scores looked like when you first started, what your organizational capacity was, and take a look at your progress over the years. And there are notes built in that will tell you, you know, what kinds of, so you see on this example that coaching was implemented in the year prior, and that may or may not have contributed to that increase in the score there. So again, a living document, an opportunity for conversation amongst your board, your staff, the appropriate stakeholder groups who care about your capacity as an organization. So let's talk, now that we know a little more about what the iCAT measures and how it shares that information. Let's talk about just sort of deciding when it might be right for you as an organization to use this tool. The iCAT is, and really any assessment tool, it tends to be most helpful when it is a piece of a larger process that is designed to understand your organization's strengths and needs. So this may be part of a larger conversation you're having related to strategic planning. This is often a really helpful tool when it comes to that piece of the strategic plan that I hope all of you have that is focused on building the capacity of your organization. This can really help inform that. It is cost effective. You have already, I assume everybody on this call is already a Forefront member. And if you're not, membership, again, one of the benefits is being able to take the iCAT once a year. So you've already invested those financial resources in and don't require any additional investment there in order to take the assessment. And because the assessment itself takes about 30 minutes per participant, it is a relatively time-efficient way to collect multiple perspectives and also to mitigate some of the power dynamics. So this is an anonymous survey. Everyone's input is equally weighted, and so it does take away some of the challenges often of collecting input and feedback on people's experience of the organization because it happens in that anonymous space. And as I mentioned, it is a conversation starter. So the report, I think, is often most useful as a place to really start to talk about, like, this is what we're seeing. How does that resonate with folks? How do these recommendations that are suggested as priority areas, does this make sense to us? And how can we start a conversation on potential spaces for change? It can also be, so again, this is a great tool for active learning and active planning. It can also be a great opportunity to do some general reflection and learning about your organization's health. If you are experiencing some challenges or some problems, as we all do, especially, from time to time, to really take a look again at those behavioral change levers and get beyond some of the symptoms to identify what the possible root of some of those problems might be, and to really involve your stakeholders, create some buy-in, and to do so with limited needed investment of resources. All right, so if you feel like, yep, I'm ready, I get it, we want to get started, or even if you don't right now, but you want to, when you think about it and at the point where you are ready, how do you get started? It is fairly simple. You can go to our website. The iCAT page is part of our programs and services page here. You'll see some of the information that we've already talked about. And at the very bottom of that page, you'll see a link that says sign up for a consultation here. You'll see it on your screen right now in orange. When you click on that, it'll take you to our handy dandy scheduler. And that will allow you to book a time with a Forefront staff person for a quick call. They can answer any questions you might have, and they can help you reason out who from your organization should participate in the survey. And we'll talk a little more about that in just a second. But we are always happy to reason that out with you. And then once you've had that conversation, they can help you get started with your iCAT. So just a little bit of context about how we work with algorithm, with the developers of the iCAT. We at Forefront serve as what they call an intermediary organization. And all you really need to know about that is that we are the main point of contact for algorithm. So we work with the iCAT developers. We launch individual nonprofit survey assessments and help you manage your report. So you get to work directly with us. You don't have to work through algorithm. We provide that service for you. As our member, as an iCAT survey taker, there will be a few different roles within your organization. that you'll want to think through when you get ready to take it. One is this account manager role, and that means that you are the main contact with us. You provide some very basic organizational information around the number of full-time employees, the organizational budget, and you're also the person who identifies who will participate in the survey from your organization, including identifying an organizational administrator. And that may be the account manager and the administrator, maybe the same person, that's okay. The organizational administrator's role is to provide some additional detailed organizational background. So there are some additional questions that they will answer as part of their survey, as well as answering the standard survey questions that everybody else will answer. And then there are your organizational participants. And they will complete the assessment, and we'll talk a little bit more about who they might be. But there should be a minimum of at least 2 of those in addition to your organizational administrator. So once you've identified those folks, or once you've signed up and said, yep, I'm in, we will do some of the back end work to get you started. And you will receive an email that looks something like this. That's for the account manager, that will allow you to create your own passwords. You'll have your own login to your system and your report once it's generated. Once you've done that, I encourage everybody to take a few minutes and think through who from your organization should participate in the survey. Generally speaking, folks are going to take about 30 minutes each. Again, the survey is confidential. It's all done online, and they are questions about your organization's capacity. We will take a look at some sample questions so you can see what those look like. You'll give some thought to that, and we'll talk a little bit more about that, and I'm happy to answer any questions that folks have as well. Once you respond to that nonprofit administrator email, you will get to, when you create your login, you will move through a few simple steps to begin your setup. It'll provide you with a little bit of background information. You will fill out some very simple organizational information, including the number of full-time employees, your annual budget, are you based in the US, what's your EIN number, city, state, and zip. You will identify an organizational administrator. Again, that's the person who's going to answer those additional questions as part of the survey, and you may assign that role to yourself or to somebody else. Either one is just fine. And then this is where you will actually identify who will take the assessment within your organization. And it gives you a little bit of guidance on this page. At least 3 people must take the iCAT, including the organizational administrator. You can assign up to 25 people to take the iCAT for a single organization. The reason for at least 3 has to do with getting some measure of diversity of voices. We do encourage that ideally all leaders and managers who are within the organization should take the assessment. And for this purpose, when we say leaders and managers, we are referring to anybody who plans for the allocation of and or manages the deployment of resources within your organization, including human and all other resources, so space, facility, technology, people, money, any of that. So again, leaders and managers in this context is anyone who plans for the allocation of and or manages the deployment of resources. So all of those folks should ideally be on this list. Again, we are happy to reason that out with you as you think about it. A couple of things to note: if you do assign any board members to complete the assessment, at least one of those board members must complete the assessment before the report can be generated. So I do encourage folks to think, to be thoughtful about who from their board they assign to take the assessment and whether they'll be available for that, for providing that feedback or not. Similarly, if any executive leaders are assigned to complete the iCAT, at least one of those must complete it before the report can be generated. And again, just a reminder that all of the survey responses are weighted equally. So someone doesn't get more weight just because they are a board member or because they're part of the senior management team. Everybody's answers count exactly the same and they're all averaged together. So once you've identified your participants, you can choose to set a completion deadline. Your survey will not close after this deadline, but that can be a helpful marker for your participants to keep an eye on. And you can set up the system to send weekly automated email reminders to all of your participants if you would like to. You don't have to do that, but that is an option. You can also send reminders manually through the system, as can we, should you choose to ask us to do that, but that is all stuff that you can manage communications with your folks on your own. Once you've entered all of that information, you will confirm that it's all correct. You can edit it if you need to, and then hit submit. Once you do that, there are a couple of emails or several emails that will go out automatically. One will go out to the person you've identified as the organizational administrator. And you're looking at a sample of that right now. And another will go out to the folks that you've invited to participate in the survey. And they all include links. Once the folks who are taking the purchase, so let's go ahead and we're going to take a look at some of the sample questions. The first thing that they'll do as a survey participant will be selecting some information about their position within the organization. And then they will answer about 135 questions, but again, the average time is about 20 to 30 minutes. This is what all of the questions generally look like. The core content of the question is bolded and it's underlined, so it makes it real clear what we're talking about. So in this example, we're talking about the organization's capacity to raise funds from corporate, foundation, and governmental funders. So we're talking about who and what very clearly. The response options for each question are always the same: low, medium, high. So we're talking about the capacity of the organization. Is it low, medium, or high, or I don't know? And questions can be skipped. So folks do not have to answer every question in order to advance through the survey. Another sample question here, just highlighting that we were, in the last one, we were talking about the organization's capacity to fundraise. Here we're talking about the board's capacity to raise funds. There is also some skip logic built into the survey in 3 different areas around strategic plan, policy and advocacy work, and facilities. So if any of those do not apply, those whole sections can be skipped. And then again, once folks have completed their survey, they can go back and edit if they wish to, otherwise they can submit it. And then once most or all of your survey respondents have completed their surveys, the administrator or point person can schedule a report interpretation call, and you will get a link to this handy dandy scheduler as part of your onboarding as an iCAT user. You'll schedule that call with a forefront staffer, and we will spend about 45 minutes with you and your team talking you through your report. So we will release your report to you once you schedule that call. And we'll spend some time talking through the report with you and just helping you make sense of what's in it and what you might want to do as a response to some of those recommendations, and making a plan around that. So that is your quick tour of the iCAT. I am curious to see if you have questions. You can type those into the Q&A or into the chat box. Would love to hear what you're thinking about the iCAT and how you might use it, or questions you have about how it works. Let's see. So Molly is asking, what kind of feedback have you received from organizations who use this tool? Great question, Molly. Thank you. So a couple of things. One that come to mind. One is context matters, and so it really does depend why you're using it matters why you're using the assessment tool and what you're hoping to get out of it. What I have heard from folks who are really eager and intentional about using it is that it has definitely informed not only their professional development planning for their staff, but it has also informed some really interesting internal conversations. So one of the first organizations that we piloted this with, when we were doing their debrief, their report debrief, there was some curiosity about a particular score. The folks who had taken, we didn't have everybody who had taken the assessment around the table, but most of the folks who had taken the assessment were there, and they were looking at a particular score and said, you know, it surprises me that this is so low. And that's one of the helpful kind of questions to ask is are there any surprises in here? How does this resonate? And they had some conversation about, you know, like, we actually do this thing really well. Like, here's some evidence that supports the fact that we actually, our capacity might be higher than what's reflected here. And so they got to have a really helpful and interesting conversation about internal communication about that capacity, and the fact that this snapshot was reflecting a lack of confidence in their capacity was actually more helpful. That lack of confidence was the conversation point, rather than boosting their capacity. They needed to boost their staff's understanding of their capacity in that area. So it can lead to a lot of, it doesn't always lead exactly where you think it's going to go, but I think if you're come into it with curiosity and a willingness to learn, that can be tremendously helpful. The other reflection that I have, or feedback that I've gotten from folks, is just has to do with the time that it takes. So first of all, it is it definitely does take time, but it is worth thinking through, again, thinking through your capacity to do capacity building. What is your bandwidth, and what is your tolerance for having sort of open-ended conversations? I think the other piece of feedback that I have gotten is that it is really tempting to take a look at those scores and see them as a grade as opposed to a snapshot. And so that's something that we definitely do try to emphasize when we are debriefing folks on their reports, but coming into it with a sense of, this is not a grade. This is, and one of the things that one of the reasons that we use the iCAT as opposed to a different kind of assessment tool is because it is not designed to be a measuring stick. It is not an assessment tool that says, here's best practice, stand up against this yardstick and see how you measure up. And if you fall short, well, then you fall short, and that's the information that you have. This really does get at those behavioral change levers that can help you make some movement. The last piece I will say is that these, I have gotten feedback that the reports can feel a little overwhelming, and you saw that they pack a lot into them. So I do encourage folks to take the approach of A, yep, this is a snapshot, and B, there are 10 recommendations in there, and we are not going to address all of them. We are going to pick one or maybe two, and we're going to be intentional about picking which one or two we choose to address, and then being intentional about how we make progress on that challenge. So thinking about it, again, as a conversation starter rather than as a mandate can be a helpful approach. I hope that helped. Molly, you can tell me if you were looking for different kinds of feedback. Great. What other questions do folks have? Okay, well, I'm not seeing any additional questions. I'm going to go ahead and stop the recording here, but I will stay on the line if anybody has additional questions that come to them. I want to thank you all for joining me. And if you have additional questions, please do feel free to reach out. We'd love to get you scheduled to take your iCAT soon. All right, take care.